Women who have given birth are supposed to be offered care and support, but a new survey has found that many mothers feel that they're being discharged from hospital before they're ready to leave.
The report by the Royal College of Midwives said a shortage of staff was affecting postnatal care. 2/3 of their members said the number of visits they could make to new parents was determined by organisational pressures rather than families' needs.
The government says that they've brought in more midwives since 2010 and are already training thousands more. Let's talk about this a little bit more with Emma Higgs. She had postnatal depression. She's here in the studio. And Virginia Howes, who is an independent midwife. She's in our studio in Tunbridge Wells. Good morning to you both. Emma, first of all, just give us a snapshot of your story, if you would.
I had my little boy Ethan in 2011. I had quite a difficult pregnancy and quite a long labour, and fell ill with postnatal depression very, very quickly, but was discharged from hospital within 48 hours, not feeling very well, hallucinating and generally not feeling ready to leave.
He's a bit bigger than that now, I expect.
Yeah.
That's even there. Did you feel you were rushed out?
Absolutely. The entire focus was on my physical health rather than my mental health. It was a case of, well, your iron levels are up now, so off you go. There was no support with regards to attachment or feeding or anything like that.
Virginia Howes, I know you're listening to this story, shaking your head. Is this something that you hear regularly?
Well, I think I do hear stories from women about not getting the appropriate care, but it's about the care, not necessarily the amount of time they spend in hospital. I don't necessarily disagree with going home early from hospital, but I do definitely disagree with not getting the appropriate care. So it's about individualised care and continuity of care, really. I mean, I look after the majority of women having home births, and I only stay with them a couple of hours after the baby's born. But they know that any time they can pick up the phone, there's no switchboard, there's no long waiting to speak to somebody that they know and trust. And that is the point. It's about good individualised care for that individual woman, so that the midwife and the woman recognise that there's a problem as soon as that problem occurs. So absolutely it's wrong that women are being, their care's being fragmented like this and cut down like this. It's not good.
We were talking earlier to the Royal College of Midwives who admitted that, yes, there are more midwives being trained, as the government said. There are more than there were in 2010. Is it a case, from what you're saying, that we almost need more care in the community after people have left hospital? Don't rush them out, but when they are out, give them the same level of care as you give them antenatal when they're in a postnatal position.
There are still a shortage of midwives, and of course the most crucial time during the whole pregnancy, birth and period is the labour and the birth, and so midwives are usually concentrated around that area, and postnatal care has always been the Cinderella service. It's always the time when the women get the least amount of care. If they stay in hospital 1 day or 10 days, that could still be exactly the same, because the concentration of midwives is for women in labour and antenatally. So yes, absolutely they need more care. It's crucial that they have good postnatal care, and it's long since been that that's not the case.
Emma, I know your situation deteriorated rapidly. What would have helped you?
For me to be treated like an individual and to have been asked, am I okay, rather than just being a tick box exercise, and for the support and advice to be there. The support and advice I got wasn't from healthcare professionals, it was from a national charity, Pandas, who I now volunteer for, but I wasn't aware that those kind of services were available.
And how, we hear lots of people saying, you know, you can always ask for help. Were you able to ask for help?
I wasn't fit to ask for help. I wasn't well, and I needed somebody to say, look, Emma, you're not okay, let me help you, rather than to have to wait to be asked. And I think if that help had come quicker, I wouldn't have got as ill as I was. And
with the work that you now do, volunteering for the charity, is this something that you hear on a regular basis still, or do you sense that anything is improving?
Absolutely, you hear it all the time. One of people's main concerns is that they didn't feel ready and they didn't feel prepared, and they came out of hospital not knowing how to bath their baby and not knowing how to feed it, and they feel inadequate, and you go out feeling really tired, and you're on a losing streak before you even start.
And Ethan's well?
Yeah, really well.
Excellent. It's lovely to see you. Good to see you looking so well as well. Emma Higgs, who's here in the studio, and thank you also to Virginia Howes in our studio in Tunbridge Wells this morning. Thank you.
It is 25 past